Welcome and good evening, everyone. Tonight, we are presenting our first webinar of this two-year cycle of the thematic working cancer group. We will update you with the state of care and recommendation. I present myself first. I'm Michele Cannone. I'm member of the Executive Committee of the European region, and I'm also the new chair of the thematic cancer working group of the region. Again, welcome everybody, and I kindly ask you to say hello and greet everybody in the chat, putting also your country so that we know from where you are. I also greet everybody from the executive committee, and in the name of the executive committee, especially Esther Mary Darcy. I'm really thrilled to have such an amazing team tonight. I will introduce them step by step, and it's my first time that I meet Professor Jacqueline Drouin. She is the founding president of the World Physiotherapy Specialty Group, IPT-HOPE, which is one of the main focuses cancer and palliative care. Professor Drouin also served the American Board of Physical Therapy Specialization as item review coordinator, and she is associate editor for the journal Rehabilitation Oncology. Her main research focuses exercise testing reliability and training adaptation among individuals in cancer survivorship. She also developed a graduate certificate in online oncology rehabilitation. Jacqueline, is an honor to have you tonight. Thank you.
Thank you very much. I'm so happy to be here.
Thank you so much. I'm going to introduce also Dr. Gráinne Sheill. She's from Ireland. She currently works at the Department of Physiotherapy at Trinity College, Dublin, and also at the Department of Physiotherapy at the St. James Hospital. And main research interests include cancer rehabilitation and especially the role of physical activity in cancer survivorship. She was involved in several research projects in cancer field, and winner of several awards. She's also a valuable member of our working group on cancer, and also she serves as a research director of IPT-HOPE. Thank you, Gráinne, to have you tonight.
Thank you, Michele.
Finally, we have Dr. Nele Adriaenssens from Belgium. She works as a part-time associate professor in Revaki at the Faculty of Physical Education and Physiotherapy of VAB. Her main research expertise is lymphology and oncology. Nele also is involved in several research projects on cancer field, and she is one of our valuable members of the cancer thematic working group. Thanks, Nele, to be with us, and thanks to spread the value of physiotherapy in the region in cancer field. Finally, I will leave the word to Nirit member, who is also member of the thematic working group on cancer, and she is also the regional member of World Physiotherapy. The floor is yours, Nirit.
Thank you, Michele. So welcome again to our webinar on the crucial role of physiotherapy in cancer care in Europe. In 2020, the European region of World Physiotherapy decided to establish a working group dedicated to physiotherapy for cancer patients. It was the first group of its kind, and we basically did it because we realized how important it was that we promote this domain of practice, which is relatively new and which is truly life-saving. And since then, we've been very busy. The work presented here tonight is part of the work done in the last term in 2022 to 2024, and the members of the working group are on the slide, and it was led by Carmen. And then the next group is just beginning to work. I'm sure we'll be busy, and it will be headed by Michele. And we will start the evening with Gráinne, who will represent a survey we conducted with the member organizations looking at the state of care in the European region, and then go on to Nele, who will present the published position statement and any updates she thinks fit. Please use the chat if you have any questions, and we will bring them up at the end of the lectures. Following the presentations and the question and answers, we will be joined by Jackie for a discussion, which I'm sure will be very, very interesting. So, Gráinne, you can now put up your presentation.
So, hi, everyone. and I'm really delighted to be here to present tonight. I'm presenting the results of this survey completed by the Cancer Working Group on behalf of all of the members. So really we were trying to get a picture of what activity is going on in cancer care in Europe. And really tonight we're presenting it to set the scene, to say, well, this is the current activity in the Europe region, and to start, I guess, discussions on how we can change and improve things going forward. So we had the aim in 2022 of really finding out about services and education in the Europe region. So the aim of the survey was to collect information from member organisations. So we contacted one member organisation, the dedicated member organisation from each country in the European region, and asked them to nominate someone from the MO who was familiar with cancer services in their country, who would be able to answer this survey as accurately as possible. And of course, the responses do depend on that person responding accurately. The information was collected with that online survey instrument, and that was developed by the Cancer Working Group. And we looked at other surveys that had been done in this area, and we looked at our work plan for the next kind of 2 years and said, well, what information do we need to know that would help us direct where we put our efforts? The survey was sent via email to all 37 member organisations in the Europe region. 33 region MOs responded, so our response rate was 89%. And you can see the countries here shaded in the dark blue that responded to the survey. And the surveys were completed between January and March of 2023. So we broke this down into 3 parts. Firstly, we were looking at service availability. We then wanted to describe the cancer services that were available. And our last part, then we wanted to look specifically at education and physiotherapy to see what was happening. So firstly, for service availability, all MOs that responded to the survey said that members provide services to people with cancer. In some form, in some shape, this was being provided. Then we asked, well, how is it being provided? And members could tick all options that were applicable to them, so they could choose multiple options. They said, well, it's provided as standard care in the public health system, and that was just over half of respondents, as private services, through cancer support charities and centres, and as part of research programmes. And those numbers were quite high. If we consider access to care, we're looking at a lot of physiotherapy cancer services provided through those last 2 options, support centres and research programmes. We then asked about referral to physiotherapy. So how can patients access physiotherapy? And 36%, so about a third of respondents, said patients could self-refer. And of course, that will reflect the self-referral options in that country. 52% said patients are unable to self-refer, so they needed someone else to generate a referral before they could access physiotherapy, usually a medical doctor. And 12% of respondents were responded not applicable to this question. There was other systems in place. How cancer care is delivered? Well, the majority of cancer care is delivered through outpatient physiotherapy sessions on an individual basis, but there was a high level of group-based sessions and inpatient acute sessions delivered also. We then asked about timing of services within the cancer continuum. So we're looking for patients to be able to access physiotherapy. Really, there's a role in cancer prevention, and then certainly from the time of diagnosis right through to survivorship or, living with cancer for prolonged periods, patients may have physiotherapy needs, I suppose, addressable by physiotherapy. So you can see how respondents answered there, with the majority of services being provided in that early recovery phase, in that first year after treatment, but really very high levels of cover in palliative care, inpatient stays, surgical inpatient stays, and actually a high level of care delivered during treatment, so during chemotherapy and radiotherapy. There's services that are probably lower in terms of cover. We have prehabilitation, again, maybe a newer innovative service where patients are brought in before they start treatment to optimize their function. And then again, with end of life, they were probably the two lower services provided. We asked about reimbursement. So how, I guess, can patients really cover the costs of care? And a third of respondents roughly reported patients can claim for reimbursement for their physiotherapy care, and then some reimbursement for another third of patients. And that really depended on 4 different things. Some countries you need a social security number. In some countries you need health insurance. In some countries this was due to charities, and charities were the one offering the reimbursement, and they had different conditions and terms for that. And then in some countries it depended on whether you had that doctor's referral for your physiotherapy or not. So dependent on a number of factors. And then we wanted to really see, well, what are the barriers to developing services? And you can see the main barriers identified here. There are more that I'll mention in a minute. But the first barrier, I guess, and the largest barrier is a lack of knowledge or understanding of the role of physiotherapy in cancer care. And that was 73% of respondents. A lack of funding for services, a lack of resources for services, and a lack of demand for services from people with cancer. And we need to take note of those, as the role of physiotherapy, and Nele will describe that later, grows. We need to make sure that we, again, have we have education in place, and we have a number of factors that will address these barriers. Other barriers that I guess weren't as prevalent and weren't as high, but still reported by different MOs. One is a lack of referrals. And again, you could tie that in with the demand for services. But I guess in some cases they said, well, there's no service available. We don't know what the interest is like. And so we have to note that. Lack of clinical pathways. So this isn't integrated into the patient's journey. So there's no prompt. I think from these responses, they felt there was no prompt for a physiotherapy referral to be sent. Difficulty changing clinical practice. So established pathways. And difficulty changing, I guess, the pathways for patients. Political barriers and a lack of support from doctors are also mentioned. So moving on to part 2. So then we asked, well, what about a description of cancer services? What do they look like? What are we doing? And the most common services provided were lymphedema therapy, followed by exercise rehabilitation done on an individual basis, and then group-based, and pelvic floor and physiotherapy was quite high as well. So again, this just gives a snapshot of kind of what services are available for patients. And again, we can see prehabilitation, one of those kind of newer services, was lower down. And then some other services provided by some MOs, but not all, physios in some MOs, education sessions, group programs, so MDT delivered sessions, and cancer rehabilitation sessions focused on pain and pain management. So interesting again to see how some services have developed in some countries and not in others. And the final part that we asked about was education. If we're thinking about workforce planning, if we're thinking about the future, if we're thinking about who's going to lead on these services going forward, as the evidence really grows, we wanted to know, well, what's happening in terms of training physiotherapists in this area. So first we asked the specific oncology training and courses included as part of physiotherapy education. So 45% reported oncology is included in undergraduate training, 15% said it's included in some postgraduate training programs, 15% reported that there's no education provided in this area, and 24% reported other. And what other really meant in this, because we asked them to elaborate, was that often the students have to choose modules. So in some programs, the students can choose oncology and modules that cover oncology topics, but often they don't, and that can be why it is available, but maybe it's not available to all students. And then we asked physiotherapists about physiotherapists having required skills to treat patients. We're trying to get an indication of confidence. is there a perception that physios do have the skills to treat patients across the cancer care continuum? And on average, patients score that 6.3 out of 10, where 10 is very confident that physiotherapists have the skills. And then we said, well, does that apply to some of the physiotherapy members or all of them? And it was split down the middle. So some people feel like, yeah, on average, you know, we're kind of 6.3 out of 10 in terms of our understanding and our knowledge of cancer care. But then there was another half that felt, no, that's some. So there are some physios that are very experienced and skilled in this area, and then others that haven't had exposure to oncology training at all. And then we asked about CPD. And again, I won't go through all of these, but maybe to pick out like the top 3. So we asked about, well, what's available? And then what's needed in terms of CPD. So if we look at, well, what's available, they're quite, I suppose, dependent on the physio taking action. So attending occasional lectures, workshops, self-directed learning, and informal discussions. They form a good part of what's available at the moment. When we asked what was needed, it was far more structured programs. So the respondents said, well, we need structured study days, and we need supervised clinical placements, and we need master level programs and postgraduate modules in oncology. So I think the overall message from this for the members of the working group was that there is a CPD available in the area, and now it's trying and consolidate those into more structured offerings. And then we asked about special interest groups to see if the different MOs in the different countries have a special interest group dedicated to oncology. So 62% of respondents do have a special interest group in oncology, which is really important. And then we asked about a register of oncology physiotherapists. How are you acknowledged, I suppose, in the country you work in as a physiotherapist working in oncology? And 27% of respondents, so 9 of the MOs, did have a register of physiotherapists, and they have recognised oncology as their speciality. The recognition requirements varied widely. So in some countries, that was a 3-year master's degree, and others, it really varied to CPD in oncology. So it is varied. One country has a 2-tiered registration system, and the top tier would be a master's, and then there's another level for patients or for physiotherapists who've done structured CPD. So it acknowledges the 2 different levels of speciality training. And one MO reported a register for those practicing lymphedema management. So to conclude, I just want to give a summary, I guess, of the main points that emerged from the survey. And I guess the points that we took from this. So we do know now that physiotherapists are providing care to patients with cancer throughout the Europe region, but it does appear from responses from the MOs, there are vast differences within the region and then often even within countries in terms of the care that's delivered. We do see a large reliance on cancer charities and research to provide physiotherapy care to patients. And respondents felt there was a lack of understanding of the role of physiotherapy in cancer care. We saw that theme come up through a lot of the service availability responses. And we did see that physiotherapists do outline a need for professional development opportunities in cancer care. So our recommendations and what was approved at the last general meeting for the working group in its next term were to explore certain, I suppose, activities in the next 2-year period. And this just gives an example of them here. We really are now looking to make links between cancer groups in different countries, given the different levels of cancer activity and the different levels of cancer knowledge and CPD in different countries. And really trying to kind of join groups and work with different groups, in some cases advocating for the role of physiotherapy through education, but with other groups it may be through policymakers and by enforcing guidelines. And developing MOOCs in this area, and that is something that we are looking at now, and how we can kind of share knowledge on a large platform throughout a large region. And then of course looking at guidelines and promoting the role of cancer physiotherapy and cancer care through the evidence base that now exists, which again we'll talk about shortly. So that report is published on the Europe region website under the thematic working group Cancer if you wanted to read more. And I just want to thank all the members of the group, and I'm very happy to take any questions on their behalf.
Thank you very much, Nirit and Michele, for the nice introduction. I also have the honor actually to present some work of our group from the previous terms. And the best part I want to focus on today is a position paper that we published. Like Gráinne already explained, what came from the survey is that one of the barriers to get into these oncological services is that it's not all people have the knowledge on the role of physiotherapy in cancer care. So I think it's a very important topic. And together with the group, we created some statements related to this role of us as a physiotherapist for in the cancer patient's journey. So this is what this part will be about. I want to take you back a few years ago because we are here in a European region. And of course, you will know that there is a Europe's Beating Cancer Plan. And as you can see, the aims of this cancer plan for the next and the previous years is on prevention, cure, and quality of life. And why I'm telling you this is because as a physiotherapist, and it will be clear in a few minutes, we can have an impact on all these different phases, from prevention up until the end of life, advanced cancer, and of course, the quality of life. So this is very important. And also to state the problem and the issue around cancer in Europe, but of course, you will know this. But it's just to create some awareness and to know what our role can be in this Beating Cancer Plan as well. As a small introduction to cancer, and what is important, I think, is that there was a big mind switch in the society of cancer and oncology from patients who received a diagnosis of cancer, that they had to rest a lot, that they had to take a lot of a pause, not start working too soon, that they had to stay in bed, not too much activity. That was some decades ago, not even so funny much decades, unfortunately. But now we are evaluating towards patients who are really literally fighting their cancer. And this is what physiotherapy is about. Together with your patient, we can do so much to fight this cancer, and especially, of course, also the side effects of the cancer and its treatment. You will be aware of the side effects of cancer, of course, but what I like to, as kind of a memory, and in the meantime, I'm struggling here with the slides, but if it's clear for you, it will work for me as well. I like to show you this slide because also for patients, it's quite nice to make the difference between an astronaut who is taking a space shuttle, going to space and coming back. He cannot even walk out of the space shuttle when he comes back to the Earth. And that's something that we can compare with all the effects on the human body when they are going through a cancer treatment. So you can see the main issues, and what we can focus on as well as a physiotherapist is the cognitive impairments, the immune dysfunction, the cardiac atrophy, but also, of course, the cardiotoxicity of many of for example, the chemotherapies, the anemia, the gastrointestinal events, exercise intolerance, which is also, of course, a very important one, the muscle atrophy, and then, of course, also the bone demineralization. So these are things that we as a physiotherapist can tackle during, and as Gráinne explained as well, maybe even before starting this treatment. What you can see at the right-hand side of this slide, and it's maybe a little small, but of course, many influences and processes are going on in the body when people receive cancer therapy. And you can see that there are three main parts. You have the muscle part, you have the fat part, and you have the food part. And so we, of course, today will focus on the left part. So the fatigue, the physical activity or inactivity, and then the muscles, which are, of course, very important for us and for the patient specifically to have in the recovery plan of the patient, so in the treatment. This is also something I would like to show you, because in the upcoming slides, we will get back to this schedule or continuum that Gráinne also mentioned already before. And this is important because it's also from already almost 2 decades ago that it was published. And you can see that there are different stages or phases in the cancer journey. We have the moment of diagnosis, but even before, there can be a preventive effect of physiotherapy or in general physical activity to prevent a diagnosis of cancer. So in the next slides, I will show you there are some cancers, types of cancer that might be prevented with physical activity. Then you have the prehabilitation that we were talking about before, the pre-treatment. During the treatment, there can also be an important effect. And then, which is maybe the most common and the most well-known in the world of physiotherapy, is the rehabilitation phase. But then there's, of course, also an important stage for palliation and end-of-life care, so depending on the trajectory of the patient. But so as Gráinne mentioned in the survey, what we have seen in the services is that the beginning, the stages of prevention and prehabilitation and the end stages, so the end of life and the palliative phase, were the least consulted. So the rehabilitation phase and the phases just before and after are the ones that are most well known and also most practiced for now. But so we really need to do something about this because, and I will show you now, even in the prevention phase, so before the diagnosis, physical activity or exercise can have a preventive effect on cancer. This is very important, and that's something that we really want to spread with all the oncologists as well and with the world, because this way we can also have an impact on, for example, socioeconomic costs. Then we have the treatment phase, and it's also prehabilitation up until the end of treatment. We see that there is an important effect on the drug tolerance, which is very important because when we have to stop or postpone the drugs because of intolerance to it, it might have an effect, of course, on the recurrence of the cancer. Also, the promotion of the treatment efficacy and the amelioration of the adverse effects of treatment are very important in this phase. And this all only due to exercise. And of course, we as a physical therapist, we are very good at coaching our patients for exercise. In the survivorship phase, it still stays important for the prevention of relapse, but also the amelioration of long-term adverse effects. And so, as we were explaining before, even in the last phase, in the palliation phase, and in the end-of-life care, it still has an important effect, even on the drug tolerance, but also on the efficacy, the amelioration, and also cancer cachexia, which is, of course, an important problem in this phase. So why was I telling you this and giving you this introduction? Because when we were thinking about what can we do as a working group for our profession as a physiotherapist in this domain of cancer, it was, of course, awareness. And so we created this cancer patient journey based on the cancer continuum, the PAC framework, as I showed you before. And so we came up with this infographic. And you can see that we also included the different stages from prevention, prehabilitation, during the cancer treatment. After the cancer treatment, you have the rehabilitation phase. Then we have after cancer, the survivorship phase. And then we have the advanced cancer, but also including the palliative care and the end-of-life care. And so we came up with the idea to make a position paper. And a position paper, it means that we came up with some and more specifically 10 statements about what can be or is our role as a physiotherapist for patients with cancer. And it starts in the prevention preventive phase, ending up until advanced cancer phase. And so what you can see at the left side of this slide is the results of this hard work that we did, and it started in 2021. So we were, at that time point, we were 11 experts in oncology from around Europe, who dived into literature, and we made this division. So we divided ourselves in smaller groups, and we looked into the literature, what can be our role. And sometimes it was very nice. We found a lot of publications, and in the last years, it became even more and more the number of publications, like, for example, in the rehabilitation phase. But it was also not really satisfying for other phases like the preventive phase and the advanced cancer phase. But so we ended up with 10 statements that I would like to show you. And when we had these statements, there was also a review by 3 different and independent reviewers who also had their input related on the statements that we gave based on the literature. So this is in a nutshell the methodology that we used. So what we discussed and what in the end was the result, so maybe the summary of all the statements, is in the prevention phase, exercise is important for cancer prevention and specifically lowers the risk of 7 common types of cancer. In the next slide, I will show you this because it might sound a little too hopeful, but it is based on evidence, and so we know this is the case. So I will show you in the next slide the numbers on this. In the prehabilitation phase, physiotherapists can provide exercise-based prehabilitation to patients with the goal of enhancing functional and physiological capacity. So what this means is actually that the fitter the patient starts at his treatment or her cancer treatment, the better she will recover afterwards. And this is something that does not only come from the oncological rehabilitation, but since many years, it has also been the case in, for example, orthopedic surgery. So when they replace a knee or something, the patients are already trained, the muscle capacity is trained just to have a better outcome after the surgery. So this is something that was implemented and that we already have evidence about from other domains in physiotherapy. And now it's also evidence-based for oncological rehabilitation. During the cancer treatment, as a physiotherapist, we manage and improve specific side effects and impairments. That's also a statement that is still true, and I think it sounds logic to you as a physiotherapist, but we also have the knowledge and the evidence about this. Another statement is prescribe and adapt exercise programs. Of course, during the cancer treatment, the physical capabilities of the patient might change. There are days that they have a better condition. Other days, maybe the day after the chemotherapy, the condition is less good. They are more tired. So we are also able to adapt these exercise programs. Also, the different cancers and the different treatments, there is a lot of heterogeneity. And so we have the skills as a physiotherapist to adapt this and to prescribe dedicated, personalized training programs. And that's also a very important statement for us as our role in physiotherapy. For the rehabilitation phase, patients should be offered access to cancer rehabilitation. That's something that Gráinne already discussed more in depth. And so I think you have seen that there is, she called it a high number, but we can do better, I think. And so we have to aim for more, as always. And another statement in the rehabilitation phase is that physiotherapy-led interventions, including exercise, are known to improve cancer-related side effects. This is also an important thing that I would like to point out. Maybe the best known intervention for physiotherapy is exercise and more in general physical activity, but there's so much more that we can do for our patients, like education, but also stress management. There are many, many things that we can help our patients with, also to overcome the cancer-related side effects and to help them even better. And that's not only based everything on exercise and physical activity. Then, as we were saying, after cancer, the best well-known, the survivorship phase, and I think if you know the American College of Sports Medicine guidelines from 2019, they were all based on this phase, this period in the cancer patient journey, but it still stands as it is. And so in this phase, our role as a physiotherapist is to monitor and treat the long-term side effects. And that's also something that we are as a physiotherapist, we have the knowledge, we have the skills to do this. Also, symptom control and optimization of function is also something that we are trained for, that we can do for our patients, and so that we should have a role in the standard care of this patient trajectory. In the advanced cancer phase, this is less well known and also less practiced, as you can see from the survey, is that the role of physiotherapy in advanced cancer includes symptom control, optimization of functional mobility, and education. So you cannot underestimate also our role in this advanced cancer, end-of-life palliative care, and so this is very important. Okay, I promised you the schedule or the numbers for the prevention phase. So what you can see here is we were talking about 7 cancer types that we can have an impact with physical activity on mortality. And you can see here that at the left side of the left column of the table, you can see pre-diagnosis physical activity. So this is really the first phase in this cancer continuum. You can see on cancer-specific mortality as well as on all-cause mortality that physical activity can have a really beneficial effect in preventing the cancer and the mortality, so dying from this cancer. But also after the diagnosis, when patients are physically active, the chances to die, so the mortality rates are much less. So this is very important in the prevention phase as well. And this is also something the Europe's Beating Cancer Plan, they need to focus on this as well. As you can see in the rehabilitation phase and the after cancer phase, so during the survivorship, I think it's also very important to let you know, or maybe you already have seen it, that there is a quite recent guideline from KNGF. It's from the Netherlands, and they are very nice in putting all this literature and guidelines together and to come up with this guideline. It's also a very nice guideline because it's not only about exercise oncology, so the physical activity, but also on education, management, etc. So I would like to recommend and invite you to read this guideline and to use it in your clinical practice, because it's also very based on clinical practice, so you can use it as a manual for your practice. That's also something I wanted to share with you, because it's an update when we look at the work that we did in 2021. And then also something I would like to share with you, because we talked a lot about side effects and adverse events. What we also did in the previous years with our working group, and which was really hard work from some of our team members, is we created fact sheets. And we are still doing this because we think it's very important, not only for the physiotherapists, but also for the patients. And we created now one on cancer-related fatigue and on cancer-associated secondary lymphedema. You have seen also from the survey that lymphedema is also very important and unfortunately a common disease or side effect of cancer treatment. So we created these fact sheets, and you can also access them through our websites. They also have a QR code, so you can also use them in your clinical practice. They are free to use on your purpose. So that's also something I wanted to share with you. And they are also very recent, so still up to date. And if they need an update, we will certainly do this for you. And last but not least, in this last phase, I was already explaining, and Gráinne also took it from the survey, we need to do more for the patients in this palliative care, in this last stage, end of life and advanced cancer. And so I think recently with the team that I'm joining in Brussels, in Belgium, we made a systematic review on the role of physiotherapy, specifically in palliative care in oncology patients. And so what we saw is that we can have an impact on the better quality of life of the patients, but there still needs to be a lot of work done. And so this is something that I think in the future we also need to focus on, because we know the earlier we start with this palliative care trajectory and with early physiotherapy, we can have such a major impact on the quality of life of the patients. And I think this is also very important to tackle this in the next few years. So I would like to add this to the last slide of Gráinne for our future purposes with the working group. I would also like to thank you, and of course, I'm happy to answer any of your questions in regard of our team, and also thank you to the team and for the organization of this webinar.
What surprised you most in the results of the survey?
Well, I think there's a lot of activity going on in cancer care, and sometimes it can be hard to know what else is happening out there. But it was interesting to see all MOs said, no, we are doing something in the area of cancer care. And then I guess what was interesting was to see maybe the need for more structured learning. We obviously have physios that really have an appetite to work in this area. And now we guess we need to meet those needs with providing those postgraduate programs. I mean, in time, all our undergraduates should have this as part of their programs. But for postgraduate physios, I think we can do a lot more to kind of make sure that people with an interest in this area have the skills to work in it.
And it seems that there is so much research coming on the subject. So how often do you think such a statement, the position statement, should be updated, or is it pretty good and research just prompts it up?
I think for now we are good with everything that we made in place. So do I need to unshare it, or does it go by himself?
No, it's okay. It's not
Okay.
shared now.
So no, for the position paper now, we are still good, but I think that we need to go more into detail. And what we did previously, it was on all types of cancer for the different paths through the journey of the patients. But I think in the future, what my dream is that we could go more into depth into the different types of cancer. For example, for a breast cancer patient, we could have the different recommendations than, for example, for a patient with a diagnosis of lung cancer, because now all the guidelines, they are for all cancer patients. And so, of course, we need to personalize the treatment and the training schedule. But I think a lot of work needs to be done in these different types of cancer. And so that's something I also see for the future that we should do.
Thanks. So, Gráinne and Jackie and Michele, if you can join us, please. So we can go. There aren't many questions, so I think we could probably go into the discussion straight away, and we'll bring up the questions as we go along. Jackie, would you like to comment on the presentations today?
Oh, yes, thank you. I would love to. This was an amazing presentation from both of you. I want to start by congratulating both of you on the amount of work that went into this initially to organize it, because what you've done with, the pre-work to make this organized is now giving us a roadmap for where we need to go at this point in time. So I think this is important research for what we need, not only in the developed countries, but in some of the developing countries. I guess it was surprising, like some people said that they had confidence of 6.3 out of 10 in their skills. Well, when we go to conferences or congresses, we have many countries that are in middle to lower income that are just asking us, how do we learn how to do cancer rehab? And so that'll segue me a little bit into the fact sheets now that Nele was presenting. We have so many people that would benefit from these fact sheets so that they could see and give these to physicians and nurses as to what we can do. And if it's possible, it would be nice to post those on our website. So maybe Nele and I can, touch base later, and then we could give it a forum. I had shared some emails too with Gráinne that I was surprised in her initial information on the survey that one of the biggest areas that's lacking is knowledge that physical therapists work with cancer patients. And when I did my initial dissertation more than 25 years ago, that was a problem. The doctors didn't know that PTs worked with cancer patients. So to see it come up again, on this important survey, I think for my students in the past and students who have kept in touch with me, that's an area that they say they go into the hospitals and the clinics and nobody knows that PTs work with cancer patients. And I think we are, in my country, we mistakenly thought we were going to get automatic referrals just because we showed up with our specialty degrees. But it's up to us to educate people, in the healthcare team, not just on the healthcare team, but also policymakers. I have colleagues that sit on national boards within the USA, and they have to debate and fight for the right to get these patients, and then also to have our names put into policy so that physical therapists are the ones that do evaluations to determine who needs physical therapy, not some other profession just making a blind referral, not knowing what we're doing. So I guess I spit out a lot of things right now, but I'm very impressed with what you're doing, and I think you're making a roadmap for where we go next.
So thank you. One of the questions that was asked by Nikos, is there a common framework for cancer education among countries? So Gráinne education, I think you are part of the education working group. Do you know if there is one?
So there are, and again, Jackie will probably know this better than us, but there are entry-level competencies available from the APTA. So if we're trying to look at entry level, what students should achieve, where we set the bar, those competencies are published. So that might be a start, but in terms of Europe and in terms of anything outside entry-level education and how you progress, there's no common framework, no.
Okay, thanks. Yeah, Jackie?
I just wanted to make a comment. Within the APTA, we do have standards for practice, and we also have the specialty certificate where graduate physical therapists who are working in the area can sit for a specialty exam. The problem with the exam and the courses is that it's not hands-on. And I think we need to get to a point in the future, like some of the other specialty groups like orthopedics, where people have to come and show their hands-on skills and go through a skill assessment to really confirm that they can do, what it is that we do in the clinic. The other comment I wanted to make was one of the countries that has the best entry-level guidelines that I'm aware of right now is Canada. And they have developed this wonderful set of guidelines for entry-level practitioners, and their entry-level degree is a master's degree. And I think that's really where even the APTA should have started, was getting these guidelines for entry level and then going on to do the specialty, because it seems like the specialists have been doing this on their own for a lot of years, but now we need to join hands with everybody and help everybody grow into those areas. So if other people want to comment on what they know about education, this might be a good time.
Why do you think, to all the panelists, please, why do you think, I mean, we've got neuro rehabilitation in basically all programs, and orthopedic rehabilitation in all programs, and respiratory therapy probably in all programs. Why is cancer behind? It's very, I mean, the education numbers weren't good. And what do you think we should do to improve it, to bring it on par with the other domains of practice? Nele, do you have any ideas?
Yeah, when I look at the literature, it started only in the 80s, I think, that there was really interventional studies, and even in the beginning it was observational studies where they looked at what is physical activity doing with these patients. And in the beginning it were only feasibility studies. Is this even possible to do this with these patients? And so I think it took a very long time before they figured out the positive effects of physical activity. And in the beginning, it was especially nurses who did these types of studies. So it was not really dedicated to the physiotherapist. And so I think that the domain, the exercise oncology, is quite new in that sense. And that but the good news is that in the past few years, there was really a boom in the literature. And so that's why now we are making, on a relatively short term, a lot of progress, I think. And actually, I'm quite hopeful. I'm a positive person as I am, but I think also for science that we will progress fast, and that we still have a lot of work to do, but that we will get there. But I think that might be one of the explanations that science took a very long time, and it was in the beginning the nurses who did all the work actually.
Thanks. So, Gráinne, there was a question regarding education as well. If in the survey there was a region, a part of Europe that stood out as having the all package, education and clinical services and research, and I don't think we actually looked at regions, right?
We didn't look at specific countries, no.
Yeah.
So we just got a broad viewpoint of all countries, but I guess we have to look to countries that have, oncology included in undergraduate education, that have clinical placements. So there's a lot of talk about kind of exposing students to oncology now as part of their training, so that it's not something that's, tagged on later, that you develop that interest from when the students are learning about clinical areas. And then I think for postgraduate countries that have structured postgraduate qualifications, I think that's really important. So those type of things are what are important to look for.
Thanks. There are some questions regarding particular patient or symptom. I think that's not the topic of our discussion today. So maybe we can have a Q&A meeting sometime with a lot of clinical questions. And there was a question from Rudolph about do physical therapists have sufficient training in exercise physiology? So I think I can answer it. I hope they do. I mean, yeah, if there isn't, if there are programs who do not have sufficient physiology and exercise physiology training, then they should bring it up more, or have more focused hours on it. And so just as we head to the end of our meeting, so what's next, right? What do you think, and what's next at at specific level, at the policy level, where we should go. At the educational, I think we pretty much discussed it. Maybe some points, and also at the clinical level, if someone wants to start an oncology service, where should he go? How should he go about it in general terms? Jackie, do you want to?
That's a tough, broad question. I think if you're in a country that's has a developed program, obviously you would join up with specialty groups, take advanced classes, participate in or at least be knowledgeable about the research that's going on. I guess I'd like to defer that to the other panel members. I don't have a really good answer for you, sorry.
Gráinne, Nele?
Go ahead, Gráinne.
Well, my thoughts really were that we kind of, we need to be involved with any kind of policy that's happening. And that sounds like a very broad answer, but it is just trying to, advocate for the role of physiotherapy with, like we would have a national cancer control program and they develop the national cancer strategy. So it's trying to engage with those type of organizations so that we're visible, so that they know what we bring to the table, because as we've discussed, sometimes it's just they're not aware of what needs to be brought. And I think data is good. If you know the unmet needs of the population, if you know where the gaps are, it's very nice then to bring the evidence and say, well, look, this is where the gaps are, and we can play an important role here. So it's, it's just connecting those dots, but really trying to reach out to people who are, these policy in terms of cancer care and cancer survivorship is developing all the time. So it's finding out who's doing that and trying to get involved there. And from a clinical point of view, I think it really is reaching out, like Jackie said, to people who are working in the area. It's trying to make those links. And after that, it's really good communication. It's communicating with other members of the MDT that really might know that you're there. It's trying to build up those relationships so that the next time someone comes in with cancer-related fatigue, something goes off in their minds and says, oh, actually, I know someone who might be able to help with that, or similar for lots of different, lots of other impairments. So, communicating and building those relationships really can't be underrated.
Thanks. Nele, do you wish to add anything?
No, I totally agree about the policy question with Gráinne. I think at the European level, some of the members of the working groups are already involved in commissions. The European Commission has some stakeholder groups, etc. And so we are going to the meetings to make our point, to make us visible, like Gráinne said. So that's something that we are doing right now already. But then I think at the level of the countries itself, there's a big heterogeneity, and you also saw it in the survey about reimbursement. And I think as long as the reimbursement does not come along, and also the direct access to the physiotherapy is different in Europe, I think it's for now every country on its own. But with the Europe Beating Cancer Plan and the European Commission, the Cancer Summit that we also attended last year and we will attend this year, I think we are giving a lot of exposure, and we are doing the things that we can do to increase this policy and to have a position for the physiotherapist in this cancer care trajectory. So we need to continue this work.
I must say, at the clinical level, our experience is that most of the referrals it's not from the oncologists. The oncologists are aware, but probably too busy or whatever. It's from the GPs, the nurses, dietitians, all kind of other professions, which were really, really crucial now it's going on. It's easy, but in the beginning, for us it was not the oncologist we got a collaboration from, but the other professions. So when we start about developing a service, I think reaching out to all is very important, and the GPs really were important in that area. So I think we're ready to go. And Michele, would you like to answer and then close the evening? And I would personally like to thank Gráinne and Nele, always excellent lectures, and the people at the office of Europe region of World Physiotherapy for making this happen. And Michele, it's
Yep.
yours. Yeah.
I want to take the chance to read the question that Birgul from Turkey was questioning the panelist about how much time do you think we need for guidelines for cancer rehabilitation based on diagnosis? And I want to add this, speaking about professional experience that we are having in the region with the project You Can Act that I lead for the Italian Association of Physiotherapy, that based is a project for prevention in cancer field. We are doing physical activity in public urban green spaces. But the approach that we had for the project, for the physical activities sessions, was based on physical activity level, from sedentary behavior to health enhancing physical activity. You know, we didn't have any special guides to approach the citizen and the patients based on cancer type. Yes, we put some alerts, some red flags, but I think that, as Nelly, you were saying, the roadmap is to produce and to seek for something specific in exercise and physiotherapy based on diagnosis. I would like to ask you, what are the priorities?
I think we should look at incidence, prevalence, and the more rare cancers, they will come later. But I think for the most common, like breast cancer, I think this is in all the European countries the biggest incidence in cancer. I think there is already a lot. But when you really dive into the literature, you can see that even within breast cancer, you have all these different kinds of cancer, like the hormone positive or the triple negative cancers. And even these different groups, they respond differently to different doses of exercise. So we know this, but for now we do not know yet what is the best dose, for example, to give to this type of patients. So I think it's really tough and a hard job, but the fact that we already know this will have more progression in this field. And so the researchers are doing a lot of efforts to have more information about this as soon as possible.
Thank you, Nelly. So thank you, everybody, for being here tonight. It was really interesting. We reached and we go over 100 participants tonight. It was a great result. It means that cancer is a very sensitive theme for us physiotherapists and professional healthcare practitioners. So thank you. This will be not the last. You will see us and all the team in the working cancer group in the next 2 years. And if you have any question, please write also the email. Some links have been gave you in the chat room. So please stay in touch, and we are here for you. Thank you, everybody.